stroke occurs when there's a sudden loss of circulation in the brain. This can be to any part of the brain, and depending on where that occurs will depend on what the presentation it is. It usually occurs because of a blockage to an artery and occasionally a hemorrhage. There are 120,000 new strokes per year, and there are also 30,000 strokes in patients who've already had one, so it's quite substantial. And there are over 1 million people who've been affected living in the UK at any one time by stroke. The causes are many. I mean, age is a major cause. 1 in 100 people over the age of 75 will suffer from a stroke. So the older you are, the more likely you are to get a stroke. There are a number of risk factors. High blood pressure is a major risk factor. Smoking, alcohol, high cholesterol, diabetes, and also a condition called atrial fibrillation, where there's an irregular heartbeat, and these patients are all at risk of stroke. Well, there's been a government campaign which has been very successful called FAST, F standing for face, where there may be an asymmetry on one side of the face. A stands for arm, such as an arm weakness. S is for speech, where there may be disturbance of speech, such as slurred speech or loss of speech. And T is for time. So if the general public see one of their relatives or whoever with these symptoms, the T is for time, they should ring 999 immediately so that these patients can be rushed to hospital and hopefully have the appropriate treatment. The crucial time is sort of within 4 hours. If we can get patients to the stroke units within 4 hours, they can have their scans and they can have this clot-busting treatment, which is readily available. There is a condition called TIA, which is a transient ischemic attack or an event where sometimes patients may temporarily lose vision, have problems with speech, or even a weakness of one side. It typically lasts seconds. It can last up to 24 hours. If patients have had a TIA, they should be referred urgently to a hospital, because a number of these patients will eventually go on to develop a stroke if they're not further investigated and treated for a TIA. Reducing the risk is all about, you can't control your age. We all get older, so we can't do anything about that at the moment. But obviously diet, eating healthy, exercise, reducing your alcohol intake, stop smoking, they're all obvious things that we should be doing. Medically speaking, with different conditions such as high blood pressure and diabetes and high cholesterol, they should always be controlled and managed to the recommended levels. So I would suggest that healthy eating, with diet, exercise and reduction of smoking and alcohol, as well as if you are hypertensive or you have high blood pressure, controlling your blood pressure and reducing risk factors such as high cholesterol, and obviously if you're diabetic, maintaining good control. And all of those will help prevention. The other condition I mentioned earlier was atrial fibrillation, which is a very important abnormality to diagnose, where patients have an irregular heart rhythm and are at risk of stroke. And we put these patients on anticoagulation drugs such as warfarin, and there are neuro drugs which we use, and they increase the benefit. These drugs increase the benefit, and there's less risk of stroke with these drugs. So it's important to be aware of this particular condition called atrial fibrillation. We're living longer, so we are developing conditions later in life which cause stroke, such as high blood pressure, diabetes, and atrial fibrillation. So it is still a major killer. We are diagnosing it a lot better. Lots of patients are on treatment which they weren't on before. And of course we have these hyperacute stroke units, which are excellent. And as I said earlier, it's the time factor. If somebody has symptoms of a stroke, getting them to hospital as early as possible so that it can have thrombolysis or clot-busting treatment. So we are diagnosing it better, but it is still a killer and is still common because of the comorbidities that patients develop as we get older. I think the public still need to be aware of stroke as a condition and the importance of referring patients quickly to their local hospital. I think the idea of prevention is still obviously very important, but it's difficult for patients who are interested in prevention but can't always afford it, such as healthy diets, going to the gym, etc. There is a cost to it. So I think a lot of the public may be cynical in respect to prevention because they continue to smoke, drink, and so on. But we as doctors can contribute to prevention by controlling their blood pressure, controlling their cholesterol, and obviously putting patients on appropriate drugs if they have got atrial fibrillation or an irregular heartbeat.